Perhaps the most challenging encounter at my dermatology office is to try to remove a bleeding or annoying growth off of an 8-year-old skin boy. I explain it to the parent and the child. I put on numbing gel and tell them I'll be back in 20 minutes. And when I return, as soon as the boy notices that there is an injection involved, their reaction usually is, a shot? No, I'm not getting a shot. No shots. I don't want a shot. It's so real. I try to calm the kid and tell him, look, I'm honest. If it's painful, you just tell me to stop, I stop. But many times I have no access and the reaction is, no shots. I don't want a shot. No. And you may think that this is only children. As of late, I've noted that many grown-up men who are dealing with side effects of other treatments and have an amazing treatment without a side effect available, put up with their side effects, but do not sign up for a procedure that involves a shot. When I present the Rhino Boost procedure to my male patients, the most common reply is, I don't need it. No, I don't need it. But I know from my dermatology practice that needing to have a procedure done for a man requires root canal level pain or urgency. If it doesn't really hurt them and it doesn't have to be done, they don't sign up for it. Unless there is a woman pushing them through the door to have something done. But most men don't want something removed off their skin, even if it doesn't look good. Even when I tell them, look, people would respect you differently and regard you differently if you had this removed off your face or body. They ask me, oh, is this cancerous? I'm like, no, it's not, but they don't want to have it done. I may not live longer having more hair after platelet-rich plasma treatment, but I think PRP has allowed me to live my life more wholesomely. There was a time that people lived much less than now. And again, PRP, whether it's for the hair or for the genitalia, it allows a man to live more confidently, happily, and wholesomely the way he did in his youth. About 4 years ago, I started offering platelet-rich plasma treatments at my office in West Los Angeles for hair growth or hair regrowth. Within a short while, I noticed that it was amazingly successful. I tried it on myself. I had another doctor inject me. And after 3 or 4 sessions, there was noticeable the hair quality difference and coverage of my scalp and hair growth. Then I learned that platelet-rich plasma injections are most successful to revive genitals in men and women. I seen what is happening to hair. I had already used the platelet-rich plasma treatment for facial rejuvenation too. So then I signed up for a hands-on course to see what's involved for the genital injections, and gosh, offer it in my practice. I inject all day. I feel I'm well versed with injections. I have a feel for the level I'm in, and I feel how the needle interacts with different tissues, different layers in the face and the rest of the body. So I thought I'd be a good candidate, a good doctor or good provider to offer this to my patients. At the hands-on course, there were 5 female models. I don't know if they were paid or had the treatment for free. And these were women who had, I guess most of them had stress urinary incontinence, or women who just wanted to have more sensitivity or more moisture, vaginal moisture, who had signed up for other doctors on their preceptorship to have the treatment done. Interestingly, there was one male model And it ended up that a few of the doctors volunteered themselves, and the doctors pretty much practice on themselves to have this treatment done, the male ones. What's fascinating is, as of late, I've noted that a number of men in their 50s or 60s wear hearing aids. And when I ask them whether they're taking Viagra or Cialis, they say yes. I explain to them that, look, this is a side effect of this medication. And either somehow they don't think that a medication that is intended for down there would affect their hearing, or they're just afraid of a shot. I've seen men who, gosh, their marriage is falling apart because they don't want to take the Viagra or Cialis. They have side effects from it, that it bothers them, like ringing in the ear or so, or they just feel strange and they can't stand the medication. And when I tell them about this procedure, platelet-rich plasma, we draw your own blood, and a portion of your own blood is injected into the tissue to reverse the trauma that's been accumulated to the genital tissue through the years, because it's a very vascular organ, didn't get enough blood supply when it wasn't in the excited mode. So the tissue is traumatized, and platelet-rich plasma contains repairing and regenerative molecules. And yes, it involves a shot, and that's how it works. That's how we can deliver proteins into you to revive the tissue again. They don't sign up for it. So then I started looking into it to see how I could offer this procedure painlessly. To numb many parts of the body, we offer the procedure after what's called a nerve block. A nerve block means, like say if I want to inject the lips of a patient, I give them 2 shots under the eyes. That's where the main nerve trunk comes out of the skull to go innervate the lip. And the 2 shots on the upper part of the cheek numbs up the entire upper lip. No pain afterwards. For the lower lip, the same way. You lift up the lip, 2 shots on the jawbone, the entire lower lip is numb. And many of you who've had dental procedures are familiar with the feeling. And again, please tell me if it hurts too much, but a little warmth is expected, and that's it. Tolerable? Mm-hmm. Here you may feel it a little more. It may be a little more of a sting, but not by a whole lot. Do you feel it at all? Or like say to inject the back of the hands with fillers. I give 2 shots on the wrist. The whole back of the hand goes numb for the next 40 minutes, and I can do the procedure painlessly. Do you feel pressure or not even pressure? Very little? Was the numbing shot painful? Very little, okay. You feel it here?
No.
No? Okay. An epidural, via which a woman can be numbed so that she can go through the childbirth and labor without or with minimal pain or no pain. That too is a nerve block. The back is injected, and the nerve comes to innervate the genitalia. The whole genitalia is numb. That too is a nerve block. Nerve blocks are used in medicine for many different areas. So platelet-rich plasma injection of the genitals is offered at my office with a nerve block, which involves 2 shots in the buttocks. And a few minutes later, the entire genital area is completely numb. It's like you turned off a circuit breaker, and now you can go touch the outlet on the wall without having any fear. And with a nerve block, in essence, we are turning off the circuit breaker, so there is no pain. But men just don't want to go for it because it involves a shot. So then I started looking into persuasion, and maybe it was the way I delivered and explained the procedure. Maybe I need to have certain psychological tactics or certain words to say to convince these grown-up children. I came across a very interesting video by Zoe Chance, a Yale professor. She's a smiley speaker, who introduced me to Daniel Kahneman's book, Thinking Fast and Slow. And Daniel Kahneman, who's a psychologist, has won a Nobel Prize in economics because of introducing this idea that humans' decisions, grown-up decisions, are primarily made by the system 1 in our brain, which is intuitive. And I guess it's the automatic decision maker in our brain. And in a way, it gets programmed based on the experiences of the past and what we've learned. So now we don't have to every time go through the whole logic and the thinking process to be able to make a decision. So if a child at age 1 or 2 remembers having had a shot and that hurting, then the brain gets programmed to absolutely avoid the shot. And when the child's a little more of a grown-up and can have a sick and can scream louder, then he just does that. And interestingly, it really seems like that the system 1 programming of our brain is carried through adulthood. And even these adult men, the behavior still is shots? No, I don't want a shot. No shots. And even though they may not say it as loudly and as childishly as the 8-year-old boy, yet they would not undergo the procedure. No matter which video I show them, even if I show them the video of I myself getting the nerve block and be able to inject myself, they will not sign up for it. Then Daniel Kahneman explains that we have a system 2 in our brain, that when system 1 notices a conflict or something not usual, it refers the decision making to the logical, more rational portion of our brain. And Daniel Kahneman, through experiments, has explained that these 2 systems kind of indeed exist in everyone's brain. That system 2 can analyze and make a decision. But oftentimes the decision of system 1 ruling cannot be overcome. I invite you to look up, read if you like, Daniel Kahneman's book, Thinking Fast and Slow. No matter which field you're in, you have to make decisions in your life, and this book helps you at least some of the time make better decisions. It teaches you the tricks certain advertisers use to sway your decision this way and that way. And I think you become a much wiser decision maker. I hope that you found this video interesting to look into platelet-rich plasma in case you or someone in your family would be a candidate for it. You may ask, well, you're a dermatologist. Are you the right specialist to have this procedure done by? At the hands-on course, I really wish somebody would videotape the different specialties who sign up to learn how to inject the genitalia with platelet-rich plasma. And I think you'll see that the dermatologists are adept in injecting far beyond most other specialties. I inject the face and body at different levels. I know when I'm in the dermis, in the fat, in what's called the SMAS on the face, or in the muscle. And the same with the genital tissue. I have a great feel with how the needle interacts with the tissue and which level I'm in. If anything, dermatologists inject much more than a urologist, for example, would.
Thank you for watching our video. If you have any questions, please call us at 310-826-2051 or visit us at brentwooddermatology.com.